So, welcome to this presentation on the common health concerns affecting patients, that is, the patient you'll be caring for as a caregiver. By way of introduction, there's that common slogan that says, good health adds life to your years. But the key message is that improving global health, older people have valuable resources for their son. So there are some common terminologies that I want us to address. Aging in intrinsic physiologic functions, death, and decrease in age persons. Now, active aging means the process of optimizing and security in order to enhance quality of life. Gerontology is the study of the physical and psychological change. Geriatrics or gerontology is the care of, and preventive geriatrics is the arts in the geriatric population, in this case, the elderly population. And WHO classification of the elderly individuals includes the old and the very old. So are referred to as elderly. People between the ages of 76 and 90 years are referred to as very old. So geriatric medicine is a branch of the medical science that deals social, rehabilitative, and psychological aspects of illness in the elderly. And some components of geriatric medicine would include preventive geriatrics. It aims to prevent development of diseases and disabilities in the elderly. Geriatric syndrome, psychogeriatrics takes care of the psychology and treats psychological diseases in the elderly. The medicine and surgery in old age, geriatrics rehabilitation, geriatrics pharmacology. The goal of geriatric medicine is to keep the aged person in the maintenance of health and maximum independence by one, early detection and appropriate treatment of diseases. Once they are discovered very early, they can be treated and an independent life. Then the second one is sympathetic care and support for persons who would experience terminal illnesses. Some risk of disease in elderly include elderly people are prone for infections. They are prone for injuries. They are prone to developing psychological problems. They are prone to developing degenerative disorders. They also have increased risk for diseases, hypertension, diabetes, cancers, and the likes. They have increased risk for disabilities, visual impairments, nerve deafness, even severe osteoporosis impeding their ability to walk without pain. Then, of course, there's increased risk of death in the very old population. Some common health problems of the aged is classified based on the problems due to the aging process. The process of aging on its own brings with it some spectrum of diseases. Then there are also problems associated with long-term illnesses. Having had an illness for a while, maybe diabetes for years, as the patient begins to age, there could be damages to the end organs, the kidneys, the livers, the nerves, the eyesight could become affected by the long-term effect of diabetes, for instance. Then psychological problems are also another classes of problems that the aged can experience. So now there are problems due to the aging process itself. Senile cataracts, glaucoma, nerve deafness, osteoporosis, emphysema, failure of special senses, failure to see well, changes in mental outlook. Now, there are also problems associated with long-term illness, degenerative diseases, cancers, accidents, diabetes, diseases of locomotor system like severe osteoarthritis of the joints, then respiratory illnesses, someone with COPD, urinary system like prostate issues could be BPH, could be BPH, which is benign prostatic hyperplasia, or carcinoma prostate. Then psychological problems. Elderly people would have mental changes like impaired memory. They may have a rigid outlook on life. They could dislike changes that are strange, that are unusual to them. Then they could also develop psychological problems from difficulty to in adjusting sexually. Then they could also have emotional disorders such as social maladjustment, This would oftentimes lead to bitterness in elderly people, commoner in women, inner withdrawal. They are at risk for depression, for weariness of life, and sometimes even suicide. So now some cardiovascular diseases that are common in the elderly would include hypertension, atherosclerosis, congestive heart failure, cardiomyopathy, and strokes. This is not the entire list. These are just the very common ones that your patient may be managed for. So you, the caregiver, also need to be in the know of this. Then hypertension is transitory or sustained elevation of systemic arterial blood pressure to a level that is greater than 140/90 millimeter mercury. And it can induce cardiovascular damage or other adverse consequences. Hypertension is graded as mild, moderate, or severe. Mild hypertension would have a systolic reading of 140 to 159 and a diastolic reading of 90 to 99. Moderate hypertension will have a systolic reading of 160 to 179 and a diastolic reading of 100 to 109 millimeter mercury. Then severe hypertension will have a systolic that is greater than or equal to 180 and a diastolic that is greater than or equal to 110. Now, this is important for when you take your blood pressure reading for your clients at home. Your expected normal should be less than 140/90. If you have something more than this, please put a call through to your supervisor or to the managing physician. Then long-term non-treated hypertension can cause damage to vital organs and it can also result in strokes. Some locomotive disorders that elderly people would have include osteoarthritis, rheumatoid arthritis, gout, fibrositis, and myositis. Osteoarthritis is the leading cause of chronic disability in elderly people because it affects the joints. And women that are less than 45 years of age, about 2% of that population have a diagnosis of osteoarthritis. Women between the ages of 45 and 64, about 30% of that population have a diagnosis of osteoarthritis. Women greater than 65, about 68% of such population have a diagnosis of osteoarthritis. So there's a very high chance that your patient that you would be providing care for has a diagnosis of osteoarthritis and may have some challenges with locomotion. Osteoarthritis of the hip is more common in men. Osteoarthritis of the knee is more common in women. Obesity is a risk factor for both knee and hand osteoarthritis. Now, cancer, the danger of cancer looms large past middle age. In elderly, cancer is the leading cause of death, unfortunately, and incidence rises rapidly after the age of 40. Now, in men, cancer of the prostate is the most common after the age of 65, and in women, breast cancer is about the most common. Cancer of the prostate, some risk factors would include age. The risk will increase with age, but 25% of diagnoses are also made in men who are younger than 65. Then having a family history of prostate cancer. A man who has a family history has 2 to 3-fold chances of having or developing cancer of the prostate. That is, has 2 to 3 times the general population chances. Then diets that is high in saturated animal fats can double the risk of developing prostate cancer. Now, and we can see the urethra. You're now coming here, the prostate is occluding the whole urethral outlet, such that there could be backflow. In most cases, the patient could come with retention. So your patient at home may not be able to pee or need a catheter to pee or need to be placed on medications to be able to pee. The patient could have one form of prostate disorder or the other. Could be benign prostatic hyperplasia, which is non-cancerous, or could be cancer of the prostate. Now, breast cancer risk factors. The older your patient is, 80% of all female breast cancer would occur among women who are older than 50. Then genetics also play a role. Family history, breast cancer gene that is discovered in an individual increases the chances of such a person having breast cancer. Obesity is also a risk factor for development of breast cancer. A woman who consumes alcohol Alcohol consumption generally is a risk factor for development of many cancers. Then estrogen therapy, especially in those who are postmenopausal and will seek to have estrogen therapy just to be able to manage the postmenopausal symptoms. Down the line, years to come, they are at risk of developing cancer of the breast. Then history of exposure to radiation therapy, maybe for one other cancer or the other in the past, would subsequently increase the chance of such an elderly woman developing breast cancer. Diabetes is a long-term illness that is due to faulty carbohydrate metabolism. It's the leading cause of death as the population continues to grow older. And about 75% of diabetics are over 50 years of age. Now, some psychological disorders that can develop in elderly people would include depression, manic depressive psychosis, Alzheimer's disease, and Parkinson's disorder. The risk factor for development of psychological disorders, being a female, the chances are higher. Social isolation, chances are higher. Someone who is widowed, who is divorced, who is separated, of course, that is also closely correlated with being isolated socially to some extent. Then someone with a lower socioeconomic status, someone who has a comorbid medical condition or conditions. Then a patient who has uncontrolled pain, who suffers from insomnia, who has functional limitations from one other medical condition or the other, someone who has cognitive impairment, is at risk of developing psychological disorders in old age. So depression is a state of low mood and aversion to activity that can have a negative effect on a person's thoughts, behavior, feelings, worldview, and physical well-being. Excuse me. Alzheimer's disease is a brain disorder which gradually destroys the ability to reason, remember, imagine, and learn, and is different from the mild forgetfulness that is normally observed in older people. The prevalence of Alzheimer's is, for every 1,000 of the population, about 33% will be diagnosed with Alzheimer's disease. Parkinson's disease or Parkinson's syndrome or atypical Parkinson's or secondary Parkinson's is a neurological syndrome that is characterized by tremor, hypokinesia, reduced movement, rigidity, and postural instability. Now, the prevalence of Parkinson for every 100,000 of the population is about 150 to 300. So now, prevention. How do we prevent the elderly persons from developing some of these diseases that will naturally come with aging? Primordial, the prevention would include a healthy lifestyle that is established during childhood. Then practices during adolescence and youth that is continued in later life are helpful in delaying the process and maintenance of a good quality of life. So the goal of primordial prevention is to add life to the years, not just merely adding years to life. Primary prevention is to identify areas that are potentially amenable. So that will be health habits. Elderly people will be advised to quit consumption of tobacco, that is cigarettes, snuffs, and the likes. Then alcohol to quit. I think that is a challenge to moderate it. Then healthy nutrition to increase their physical activity, and of course to have adequate sleep. Then the elderly people will also be encouraged to have very robust social activity, social lifestyle. Then medical efforts will be put in place to prevent coronary heart disease risk factor. Hypertension should be well managed. Diabetes should be well managed. And immunization for some respiratory tract infections that are fairly common in elderly person. Even immunization from teenagers to prevent cancers like cervical cancer that will come from human papilloma virus. Then injury prevention, wearing sensible shoes. having non-slip rocks within the house, just things that can prevent them from falling. An elderly person who has impaired vision should have a pair of glasses or see the ophthalmologist to see what could be causing the visual impairment. Perhaps it's cataract, perhaps it's glaucoma, just something that can be prevented. Someone who has hearing impairment should get a pair of hearing aids. Then osteoporosis prevention would include exercise, calcium-containing diets. So now some health habits that is important to keep in mind for primary prevention of diseases in the elderly. Tobacco use in any form should be discouraged. It's not to be moderated, should be discouraged. And that could be via education, you counsel the elderly persons, legislation that could be nationwide, in controlling production of tobacco and sale and consumption of tobacco should also be controlled, because tobacco contributes to the development of diseases of the lung and oral cavity, lung cancer, COPD, oral cancers. Then also contributes to development of heart diseases, contribute to development of cancer and diseases of the peripheral blood vessels. Alcohol. Now, sensitivity to the effect of alcohol increases with age. The older the individual gets, the more sensitive they will be to the side effect of alcohol. So older people have a decreased ability to develop tolerance to increasing amounts of alcohol. So intake should be restricted to 60 ml per day. And excessive alcohol consumption is linked to liver diseases, stomach ulcer, gout, depression, osteoporosis, heart disease, breast cancer, diabetes, and hypertension. So some dietary modification that is also important as a prevention for elderly people developing diseases as they age is saturated and trans fatty acids should be discouraged. Salt intake should be limited. Mono and polyunsaturated fatty acids should be encouraged. Those are the LDL facts. Then they should also be encouraged to take a lot of fiber-containing foods that are also rich in micronutrients. Calcium and vitamin D rich food should be encouraged. Then, of course, the elderly person should drink a lot of water. Physical activity should also be encouraged. Regular exercise will help to maintain good health by helping to control the weight of the elderly person, improve their emotional well-being, improve blood circulation. It will increase flexibility and balance. It will help to lower blood pressure and blood sugar. And it will improve bone density, and also it promotes the sleep, makes them sleep better. Then it's also important that the elderly people have a robust social life. And this would involve social activities like joining various social clubs, doing various cultural, creative, and recreational activities, because it helps to lower stress, and psychologically, it's a positive psychological boost for elderly persons. Immune system function is compromised in the elderly persons. So elderly people are more vulnerable to infection. So influenza vaccine is advised above the age of 65, and it's given every year. It's a trivalent inactivated vaccine that's administered as a dose of 0.5 ml intramuscularly. Then chemoprophylaxis with amantadine or rimantadine is also advised for persons who are really at risk. Then pneumococcal pneumonia, there's also a vaccine that is given above the age of 65. It is given once in a lifetime as a single dose of 0.5 ml intramuscularly or subcutaneous. Then tetanus, elderly people need a full course of tetanus toxoid again with a booster dose every 10 years. Now, injury prevention in elderly people. First is to even prevent osteoporosis, and that would include regular physical activities. Then their diet should be rich in calcium and vitamin D. Then they could also go ahead to take the supplements of calcium and vitamin D. Then the floor of their house should be sleep resistant, should be firm rocks that elderly people cannot sleep on easily. Then, of course, sensible shoes. Elderly people can fall very easily, and a simple fall can cause a fracture. So sensible shoes then will be things that are flat, footwears that are flat, that are lightweight, and has a good grip, not heels that can make them prone to a fall. Then the stairways should also have some non-slip tread carpets. There should be handrails on the stairways that they can hold on to while they're walking. Then staircases are best if they have contrasting color, especially for elderly people who have visual impairment, so they can know when to take the next step. The color will be a pointer to them. Now we're taking the next step. So now secondary prevention. The geriatric team would consist of the geriatricians, the nurses, the physiotherapists, the social worker, the health worker, and of course you, the wonderful caregiver. So one must remember that investigations that are suboptimal or undue or unnecessary should be avoided. So investigate with the aim of finding out the suspicion, not just arbitrarily run investigation to no definite aim or no definite end. Then while interpreting investigation results, the geriatric team have to keep in mind that there are some age-related variables for investigation results generally. Then, as much as possible, non-invasive tests are preferred than invasive tests for the elderly people. Then polypharmacy should be avoided whenever possible because many times their end organs are not functioning as optimally as they did when they were younger. So ability to excrete these drugs is a challenge. Then they're also more prone to side effects of medications. Then the regular review of medication is a must. To this end, elderly people should be brought for frequent checkups, at least monthly, for frequent checkups. So the onus is also on the caregiver to remember to ensure that the elderly person gets his or her clinic follow-up as recommended. Now, for disease screening in elderly people, mammography is a non-invasive mechanism of screening for breast cancer. Clinical examination of the eyes is a non-invasive method of screening for cataract. Pap smear is a non-invasive method for screening for cervical cancer. Then colorectal cancer, the stool can be taken for occult blood. Then coronary artery disease, of course, risk analysis, hypertension, diabetes, ECG, some other blood work. Deafness is a clinical examination, whisper test or geometry, and if it's found that such an elderly person has nerve deafness, hearing aid can be recommended. Then mini mental state examination should be done to assess for dementia. Diabetes mellitus blood glucose estimation is a must for elderly persons who come to the hospital. Then diabetic retinopathic fundoscopic examination for angiography can be done by the ophthalmologist. Then lipid profile for dyslipidemia, glaucoma could have intraocular pressure monitored by the tonometry. Then blood pressure recording to screen for hypertension, chest x-ray to screen for lung cancer, bone densitometry after risk assessment for osteoporosis, and rectal examination, prostate-specific antigen as a screening for prostate cancer and benign prostatic hyperplasia. So now tertiary care and rehabilitation. This is applicable to ensure rehabilitation and use of the remaining capacity that the elderly person has. So rehabilitation is an essential constituent of geriatrics, and it comprises of rehablement, that is acquisition of skills that are needed for leading an independent life. Then resettlement, that is restoration of patients to his or her own or another environment. And it's for the implementation of this, the geriatric team is required to be able to provide a good quality of life to the elderly. So what's the need for rehabilitation? The elderly people form a vital and a vulnerable part of the population because they are more prone to getting infections, diseases, accidents, and emotional and psychological disturbances, as we said earlier. But elders are also a rich bank of wisdom. because they have life experiences which can be used for the benefit of the society and community. As such, the residual capacity of elderly people can be used in a number of measures. They could work in development of programs like health education, literacy drive, child welfare, mass education, and other national building activities. Now, the increasing trend of nuclear families may lead to more stress in the coming years, but the presence of an elderly person can also reduce the burden. Now, types of care and rehabilitation. The tertiary care and rehabilitation are provided through medical care and rehabilitation, through social rehabilitation, through economic rehabilitation, through psychological rehabilitation. Social rehabilitation, people who are socially isolated are less healthy, really. They are less healthy. No, if they don't have a lot of relatives, a lot of friends, they're generally less healthy. So an elderly person that gets out and keeps involved with other people will be creating a sense of belonging for himself. And it can be described under the following heads: the role of the family in social rehabilitation, role of the community in social rehabilitation, the role of the spiritual community too in social rehabilitation. Excuse me. Nearly 80% of the elderly people in rural and urban areas are living in joint families. So family can be a pivotal institution or the sheet anchor for rehabilitation of elderly people socially. And the family will ensure social, economic, and emotional security and would ensure most congenial environments for the elderly ones. So it's the family first before we get to the community. And family needs them and they need family support. This way it's a symbiotic and mutual support that is self-fulfilling and coexistent. So first is the social rehabilitation of an elderly person is best done by the family. But in situations where those are not possible, that is where the caregiver comes in, that is where the community comes in, that's where the spiritual aid also come in. Psychological rehabilitation would include counseling of the elderly person and encouragement of self-care so that they can become independent, at least for the activities of daily life, assuming that there are no comorbid medical conditions that is hampering their independence. Then improving the number of people receiving treatment for psychological disorder, because once you are able to psychologically rehabilitate, you also will reduce the number of people who would have a psychological disorder. Then family members can be counseled so that they can give emotional support to their elderly persons. So rehabilitation strategies for substance abuse, it's unfortunate, but it's a fact that there are also some elderly persons who will suffer from substance use disorders. So such persons will benefit from psychotherapy with the aim of teaching the patient new method of interacting in a drug-free environment, then also making the person aware of the losses and isolation that has resulted from the substance use disorder. Then they could also have group, family, and network therapy for damage to the family, because every substance use disorder is a family problem, it's just not an individual problem. So the family would also need therapy to restore the damage that has been done. Such elderly person could also benefit from peer relationships to recover from the substance use disorder. Then it should be optimized by age-specific treatment. Economic rehabilitation is just a way for the elderly person to become economically viable, economically sustained. So that could be through pensions, that could be through income generation opportunities for persons who are able and are willing. Then schemes for contributory pensions for older people who can afford to save in their prime years. Then also special schemes for the women, for the poor, the destitute, the disabled older persons, for widows. Those should be employed. Okay, so with this we come to the end of this slide. Thank you for staying with me.